Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. It's always great to see you, Doc. Thanks for joining us. There's a new study from the CDC that estimates that the number of COVID-19 infections reported from March to May is likely 10 times higher, or perhaps even more than that, than the official estimate. So if that's the case, does it change the possibility for another surge of the virus, and does it help with the overall population's immunity?
Well, Ed, I think what we're seeing when we hear about these serologic surveys is that many more people have been infected by the virus than those that have had confirmed cases through the swabs. But still, when you look at the numbers, those estimates looking at about 16,000 people across the country made it look like between 1% and 7% of the people tested were positive. That's still a small number, so we're not even close to herd immunity. I think that we have to assume that there's going to be more waves or more peaks of this virus.
Doctor, the MIAA is now saying that the earliest practice for fall sports that it can begin September 14th, which is about a 3-week delay. So in your opinion, what type of precautions have to be in place to make sports like soccer or football or any outdoor sport possible?
Right, Maria. This is always difficult to predict with sports because not all sports are the same. Some have more close contact, others don't. Kids are different ages and they can follow some of the prevention methods that we know work. It's going to be different. So I think the most important thing is we have to see what is life like in Massachusetts in September. If the virus is on a surge, then there may be a good chance that we're not going to be able to go forward with sports. If we're controlling the virus and doing those things that are working, and perhaps with more frequent testing, then it may be possible that some of these sports can resume.
Dr. Ellerin, thank you so much for joining us. Be well, continue to be well. It's always great to see you.
Be well. Thank you, doctor.